Dr. Kamath, thank you for joining us today on behalf of the JLI. You're known not only for decades of clinical excellence, but also for your leadership in primary care, your deep commitment to geriatrics, and your extraordinary dedication to mentorship and giving back. As my mentor and the mentor of many others, it's truly an honor to have you. To begin with, could you walk us through your journey from medical school to leading a primary care center in Massapequa?
Kevin, let me start by saying it's truly a blessing to be a part of the Johnite family and interviewing me this evening on behalf of the JLI. I joined St. John's Medical College in the year 1967 and I am from the 5th batch of St. John's. After receiving an excellent world-class education at St. John's, I came to the United States in 1974 and started my surgical residency year 1 at Brookdale Hospital Medical Center. This was followed by a year of postgraduate training in internal medicine at Coney Island Hospital and 2 years of family practice residency at South Nassau Community Hospital in Oceanside, New York. Family practice as a specialty was just beginning to be evolving. In the 70s, it was general practice and the pendulum swung towards specialties, and again in the 70s, it came towards primary care, and I was one of the first few batches to be chosen to start a family practice residency at Stony Brook University in Long Island. I chose to do primary care and embraced it as a lifelong commitment. I founded Island Primary Medical Care Associates in 1978 and 79 at Massapequa in Long Island, followed by offices in Babylon and Wantagh. Over the years, the practice grew and it now is currently a 6-man practice serving 3 hospitals and a couple of nursing homes.
As a primary care resident myself, I've always wondered what initially drew you to primary care and what kept you committed over the years.
Primary care allowed me to practice medicine to the fullest sense. Initially, due to my training as a family physician, I saw children, newborns, prenatal care, and delivered even a few babies during my career. My adult practice started as hospital on-call service to the hospitals, taking care of inpatients, and as an outpatient visits in my offices. Due to my surgical training, I was able to assist in surgery in major operations and also perform minor surgical procedures, even reduce fractures at times in the office. Continuity of care and long-term relationship to my patients gave my work meaning and purpose.
So, that's a very interesting journey, Dr. Kamath. How do you think your early training shaped you to be the physician you are today?
My education at St. John's Medical College gave me a strong foundation and instilled values that propelled me and prepared me to practice anywhere in the world. The firm grounding allowed me to adapt to the US healthcare system while remaining patient-centered all the time. The spirit of volunteerism and a missionary spirit that was instilled in us at St. John's helped me to take care of the needy and the poor all through my practice.
As the founder of a practice that is still very influential on Long Island, what did a typical day look like for you while you were building your practice on Long Island?
Initially, there was no day or no night. I was on call all the time, covering my practice 7 days a week, hardly taking any vacations. I was used to covering emergency room and making myself available to any hospital that needed my services. Each morning, the day would start at 6:30 or 7 o'clock doing hospital rounds, a full day in the office, followed by any emergencies that I had to take care of after hours. I had to do school physicals, night calls, and anything that was available to me by covering other physicians in the community. For a decade, it was long hours and challenging to be alone in the practice. But due to a clear vision and focus and hard work, I was able to take on more physicians as partners. As I said, it was challenging, but I had to build a comprehensive, patient-centered primary care practice ground up.
I don't think I worked this hard even as a resident. And this sounds like quite the task for one person to juggle. How do you think you balance clinical care with administrative and leadership responsibilities?
As the partnership expanded, my goal was to build a multi partner, multi location practice capable of delivering outpatient care, inpatient hospital care, and nursing home care. Teamwork and carefully chosen partners and adherence to strict clinical guidelines and ethical sound billing practices and building a reputation as a physician who was available all the time allowed us as a group to maintain quality while growing responsibly.
As someone who has witnessed medicine evolve over the years, how has primary care in suburban New York evolved over the past decade?
As I said earlier, Kevin, in the 70s, general practice had faded away and specialty oriented practice was the norm. The average patient received more specialty care and there was no primary care physicians available to them all the time. As an example, a physician's mother came to me complaining of chest pain. By that time, she had already seen a cardiologist and a pulmonary doctor, had a stress test and pulmonary functions, and was asked by me to evaluate her. During my short interview with her and my quick physical examination, I discovered that she had Graves' disease as evidenced by a large goiter. Immediately, she was subjected to the proper tests and given radioactive iodide, and to this date, she's feeling much better from the quick diagnosis, whereas she had been to specialists where nobody had even cared to do a thorough physical examination. As you said, primary care has become the backbone of healthcare delivery in the suburban areas and the United States right now. The new primary care physician truly coordinates care, acting as the captain of the ship and a gatekeeper, ensuring patient receives appropriate, timely, and efficient care, keeping in mind the costs and convenience to the patient.
That's a very interesting story, and I think it really brings through the importance of a thorough physical exam for all of our juniors. So, the next question is, what are the most common challenges you see in your patient population today?
One of the problems is it takes a long time for a patient to get an appointment with the primary care physician, and if there's an emergency, there is a big difficulty in getting the appointment the same day. Access is the problem to good primary care and a dedicated primary care physician. Without that, the healthcare system becomes fragmented, and we have a system whereby every patient gets an appointment the same day when the patient calls in for an emergency.
I agree, Dr. Kamath. Most of our physicians are booked out for a few months at least. It's amazing that you maintain such a large panel and still manage to fit in your patients whenever they need to see you. Now, moving on to speak about your passion, geriatrics, as we all know. What do you find, or what do you think clinicians often underestimate about geriatric care?
Many underestimate how complex geriatric care truly is. As my practice matured, I noticed that 60 to 70% of my patients were in the older adult group. The new focus on geriatric care started evolving, and I was able to be grandfathered into taking added qualification and take the boards in geriatric medicine and be board certified. This deepened my understanding and commitment to geriatric care, not only as regarding medical issues, but functional status, family dynamics, quality of life, end of life issues, hospice, etc.
And as someone who's witnessed geriatric care in both subcontinents, here in America and in India, how do you think geriatric care in the US is different from what you observed during your training in India?
During my training in India, geriatrics and gerontology was largely absent in the medical school curriculum. This gap motivated me to bring this structured geriatric education back to my alma mater and create interest in the field among young Johnites. I was very fortunate enough to meet Dr. Arvind Kasturi during my visit for the tsunami relief in the year 2005. Dr. Arvind Kasturi had already started a senior citizen health services program in the college in the year 2003. During our discussions, we found common ground to see that we can bring geriatric ideas and principles to St. John's by inviting faculty members from Mount Sinai, notably Dr. Robert Butler and Dr. Harrison Bloom and Fred Sherman from the International Longevity Center. During their trips to Bangalore and visiting St. John's, they found that it was a very fertile ground for a program in geriatric to be initiated and gave us the roadmap to start a geriatric center both in the urban and in the rural areas. The work continued, and the department, I'm proud to say that it has evolved into a full-fledged geriatric department, and with the help of the St. John's administration and CBCI, the idea of opening a geriatric center was commissioned, and in February we had the grand opening of the geriatric center.
That's a very inspiring story, Dr. Kamath. It's amazing to see how this vision has come to reality. Now, what are the biggest gaps you see today in how healthcare systems approach aging populations?
Following this meeting in Bangalore, we were able, Dr. Arvind and I, to address needs of geriatric care at the Global Summit of Healthcare in India. The systems often lack coordinated long-term planning for the aging all over the world. Preventive care, functional assessment, caregiver support, end-of-life planning, hospice care, and successful aging concepts are hardly discussed and addressed, and often frequently addressed too late in the game. Strong primary care integrated with geriatric training are essential to closing these gaps, Kevin.
If you could change one thing about geriatric care delivery, what do you think it would be, Dr. Kamath?
Let me briefly address the situation with the geriatric statistics. The elderly at large in India are at about 130 million and growing at a pace of 9.8 per year. This is expected to reach about 20% in the year 2050 in India. In the US alone, by 2030, 1 in 5 Americans will be over the age of 65, and that is about 70 million. Elderly population above the age of 65 will be 8%, which is currently at 8%, will be at about 21% by the year 2050. So, we need to address this huge problem. I would make quality geriatric care universally available regardless of geography and socio-economic status, and available to all the elderly in India, and take care of the neglected, the indigent, underserved, voiceless, and take care of the uplift of the poor.
Those numbers really put things into perspective, and I agree that geriatric care should be expanded upon. Now, on to the next question. You've been a major donor and helped establish a geriatric center at St. John's. What motivated you to give back in this way?
St. John's shaped my career and my values. As the vision statement stated, it was to train young men and women to serve the poor wherever they go and in a missionary attitude. Supporting my alma mater and adopting the Department of Geriatrics was my way of giving back and ensuring future generations' physicians are better prepared to care for an aging population. During the early years, I was fortunate enough to be a founding member of the Friends of St. John's and a past president of the Alumni Association at North American chapter. And I was fortunate to work with giants like Ephraim Topil and George Verghese and establish a permanent vehicle to collect and gather funds and support the various projects that were going on in the institution. Through various programs like the Physician Exchange Program, fundraisers, including multiple golf outings, to raise money for the much needed program at the alma mater.
That is a very nice reminder of our institutional motto for our rising stars in JLI. Why do you believe geriatrics deserves dedicated infrastructure in Indian medical colleges?
India's aging population requires structured geriatric education in all of the medical schools. The new geriatric center, I hope, will fulfill this need in terms of teaching, research, and dissemination of the best practices across other institutions and all the other medical schools in India, and help the sister doctors program of about 1,000 strong to deliver better care and support their geriatric initiatives wherever they are serving in different parts of the country. I hope that in the near future, I will be able to endow a chair in geriatrics to attract the best faculty to train the young geriatricians at the institution, and also find a donor for the telemedicine center, and also start a geriatric steering committee of all the alumni all over the world to give back ideas as to make this center the best in the country and, for that matter, all over the world.
Thank you for the well thought out answer, Dr. Kamath. You've mentored students from around the world, Johnites and non Johnite alike, often in very personal ways. And as someone who's directly benefited from that mentorship, I've always wondered what motivated that level of involvement.
My memories go back to my training during my postgraduate at St. Martha's Hospital in the Department of Surgery under Dr. Joseph Anthony, who was my mentor, my friend, and my guide, who helped me make decisions to come to the United States, leaving behind a career in surgery in India. When I first landed, my friends and mentors, Dr. Kishi Padmanabhan, John Mani, Gyana Reddy, helped me immensely to get settled and helped me plan my future in the field that I was going to take. Over the years, I opened my office and the small loft above my office to students to come and stay and get acclimated, plan their future, join me on rounds in the hospital as well as the office. The focus was on learning without worrying and about their logistics or their financial pressures. I viewed it as removing barriers. Dozens of St. John's students have come and gone, and I'm lucky to say that almost all of them got matched into various programs and were able to benefit from the time during their stay in my loft and my practice.
I think everyone has very fond memories of your mentorship of your office and specifically staying in the loft. I think the saying was, no one that stays in the loft goes unmatched. How important do you think is it for alumni to stay connected with their parent institution?
It is very, very important to stay connected with your alma mater, because the institution that nurtured you and gave you, made you what you are, is very important and to be recognized with. And staying connected allows us to give back meaningfully and support all their future programs for the future generations at the institution. As a grateful member of the institution, my plea to all of you Johnites is to support the various scholarship needs for the needy students. Do a physician exchange program to bring faculty and exchange students between the two countries. Adopt a department at St. John's Medical College depending on your specialty. Help young alumni through their plans through the Johnite Launchpad. Help the Sister Nun Project to continue the good work they're doing all over the country. Endow chairs in various departments of your choice through the Friends of St. John's, which is a phenomenal organization that is helping the institution.
I think that's solid advice for all of our Johnites who are now residents as well. Now moving on to the next segment, which is about your advice for young doctors and IMGs. What advice would you offer young doctors torn between staying in India or pursuing opportunities abroad?
Kevin, it's a deeply personal decision. Opportunity exists everywhere. There is no right time or wrong time to come to the United States. Once you choose a path to come to the United States, commitment, perseverance, integrity are essential to succeed. This takes me back to the early career initiative that was initiated by Dr. Brian Martis, Sean, Michael, and Savio, and currently being carried forth by Dr. Dominic Stresta through the Junior Career Launchpad Initiative.
Right.
Now, this helps the students to come and get acculturated and acclimated to the United States of America and succeed in their endeavors.
I think this is a good message for all of our young Johnites that are on the fence regarding whether to come to the US. Now, on the same vein, what qualities are essential for success in US primary care?
It is obvious that you need dedication to your field, you need to be adaptable, professionalism, strong communication skills, and compassion are essential to succeed and do well in your field.
And you've mentored a lot of young students who are now residents, physicians as well. What common mistakes have you seen early career physicians make, Dr. Kamath?
I think it's very essential that you have proper preparation. Lack of preparation, poor preparation for the exams like the USMLE, not getting good scores, incomplete commitment, and not being able to adapt to the new surroundings. Strong ethical values are needed. Good preparation for the interviews and professionalism and communication skills are all matter to the success of your matching in this country.
Thank you for this valuable advice, Dr. Kamath. I know the process now places a higher emphasis on scores. So, what do you think differentiates a strong residency applicant beyond their scores?
Beyond scores, professionalism, communication skills, adaptability, and strong work ethic are very critical. Residency programs value individuals who function well within their teams and show humility and willingness to learn.
And as someone who has written a lot of recommendation letters in your lifetime, what role do recommendation letters play today?
Strong letters from reputable faculty, preferably from physicians in the United States and India who know the candidate very well and can vouch for them, really can be very impactful.
And looking at today's residency match landscape, what advice would you give IMGs and especially junior Johnites that are coming in?
Never lose hope. Keep trying. Commit fully to your process. Keep your cool. Everything will fall into place eventually. And pursue your goal. I mostly think of a few candidates who had given up their attempts at matching and were despondent. Finally, through their perseverance and dedication to their field, were able to be matched in their specialty of choice. And sometimes it is luck. A certain resident suddenly gets dropped out from a program, and if you are able to connect with the residency program director, which I was able to do so for a couple of people and place them in the right position at the right time, we have been successful. So it's also luck that matters to a large extent.
I agree, Dr. Kamath. I think everyone has their own journey in this match process, and it's important to not lose hope. Now, moving on to the next segment on reflections and legacy. Looking back, what has been the most fulfilling part of your career?
Building a comprehensive primary care practice for a guy who initially wanted only a subspecialty in surgery, embracing primary care to the fullest, and building a practice ground up and seeing it succeed was truly fulfilling for me in very many ways.
And is there a patient moment that reaffirmed your choice of primary care?
The gratitude and well wishes of my patients over the last 50 years keeps me going. They continued to believe in me and trust in me to be their primary care physician, which is truly gratifying. From a number of patients whose families I am treating for 4 generations, octogenarians and 100-year-old patients that have been seeing me for the past 40 years, makes me truly wanted.
And now with AI and technology playing a big role in medicine, what excites you about the future of medicine?
Technology is something that I was not used to as I was growing up in St. John's. But technology is advancing rapidly and young physicians are nervous about the upcoming AI and its applications. But truly, compassionate and caring, well-trained clinicians will always be needed to deliver medical care. As long as technology is used in a well-thought-of process and a caring physician is behind it, it will always work out in delivering care.
And to the last question of this segment, how would you like to be remembered, Dr. Kamath?
As someone who is very grateful for the education he received from his alma mater, as someone who is very thankful to his teachers for the wonderful education, as someone who deeply cared for his patients and people in need, someone who helped and guided young future physicians from St. John's and elsewhere in different parts of the world.